Process is USG, MRI, CT scan, pleural biopsy. Question is investigation of choice in asbestosis is, the answer is CT scan. The second one is function of orbicularis oculi is, function of orbicularis oculi is closing the lid, opening the lid, helps in accommodation, pupillary dilatation. Question is function of orbicularis oculi is, function of orbicularis oculi. Function of orbicularis oculi is closing the eyelid. Closing the eyelid. Template used in PCR test is, template used in PCR test is RNA, protein, ssDNA or double strand DNA. Template, which template are used in PCR test? RNA, protein or single strand DNA or double strand DNA? The answer is double strand DNA. And another one is beta adrenergic receptors usually binds to beta adrenergic receptor usually bind to GS protein, GI protein, GO protein or G alpha protein. Beta adrenergic receptors usually bind to, the answer is GS protein. GS stands for adenylyl cyclase activation, calcium channel opening. Adenylyl cyclase activation. Now we are moving to another. Treatment of stage 2B. Treatment of stage 2B cervical carcinoma is, treatment of stage 2B cervical carcinoma is simple hysterectomy, radical hysterectomy with pelvic lymphadenopathy. Radical hysterectomy with cervical with pelvic lymphadenectomy. Simple hysterectomy. B. Radical hysterectomy with pelvic lymphadenectomy. C. Chemoradiation. D. Trachelectomy. Treatment of stage 2B cervical carcinoma. Treatment of stage 2B cervical carcinoma is chemoradiation. Treatment of stage 2B cervical carcinoma is chemoradiation. Up to stage 2A can be treated by surgery. Stage 2B to stage 4 chemoradiation, palliative surgery or chemoradiation, palliative radiotherapy used. Carrying angle 2. carrying angle of elbow. Carrying angle. Carrying angle of elbow is 15 degree varus, 15 degree valgus, 125 degree varus, 125 degree valgus. Carrying angle of elbow is, the answer is 15 degree valgus, not varus. Varus or valgus. It's away from axis or towards axis. Valgus, varus, valgus, towards axis. That means 15 degree valgus. 15 degree valgus. Now another question. Yeah. A child presents in OPD with unilateral nasal obstruction for long time and blood thin discharge. What is the most probable diagnosis? A child presents in OPD. A child presents in OPD with unilateral nasal obstruction for long time and blood thin discharge. What is the most probable diagnosis? A. Foreign body, nasopharyngeal angiofibroma, nasopharyngeal carcinoma, nasal polyp. Question is, a child presents in OPD with unilateral nasal obstruction for long time and blood thin discharge. What is the most probable diagnosis? Foreign body, nasopharyngeal angiofibroma, nasopharyngeal carcinoma, nasal polyp. A child presents in OPD with unilateral nasal obstruction. Unilateral nasal obstruction for long time and blood thin discharge. What is the most probable diagnosis? Foreign body, nasopharyngeal angiofibroma, nasopharyngeal carcinoma, nasal polyps. The answer is foreign body. The answer is foreign body. Explanation is, it's foreign bodies. Etiological, they are mostly seen in children and may be organic or inorganic. Pieces of paper, chalk, butter, pebbles, and seeds are the common objects. Pieces of cotton or swabs may be accidentally left in the nose. Now we shall move to another question. Dry cough in SCE inhibitors use is due to production of dry cough in SCE inhibitors used due to production of renin, A. Renin, B. Aldosterone, C. Bradykinin, D. Histamine. Dry cough in SCE inhibitors used due to production of renin, aldosterone, bradykinin, histamine. The answer is bradykinin. Dry cough in SCE inhibitor used due to production of bradykinin. Explanation. Nevertheless, elevated kinins and PGs whose synthesis is enhanced by kinins may be responsible for cough and angioedema induced by SCE inhibitors in susceptible individuals. SCE inhibitors interfere with degradation of substance P also. Cough. A persistent brassy cough occurs in 10 to 16% patients within 1 to 8 weeks of requires discontinuation of the drug subsides 4 to 6 days. Now we shall move to another questions. A pregnant woman presents with 12 weeks gestation. A pregnant woman presents with 12 weeks gestation comes to OPD with the complaint of grape-like vesicle passing through the vagina. Size of the uterus is more than expected size. What is the best treatment in this case? Prostaglandin, oxytocin, dilatation and curettage, suction and evacuation. A pregnant woman presents with 12 weeks gestation comes to OPD with the complaint of grape-like vesicles passing through the vagina. Size of grape-like vesicles passing through the vagina. Size of the uterus is more than expected size. What is the best treatment in this case? A. Prostaglandin. B. Oxytocin. C. Dilatation and curettage. D. Suction and evacuation. The answer is D. Suction and evacuation, because explanation. Management with the use of ultrasonography and sensitive USG. Sensitive SCG testing diagnosis is made early in majority of the cases. The principle in the management are suction evacuation of the uterus. Suction evacuation of the uterus as early as the diagnosis is made. Now shall we move to another question. A boy comes to the OPD. A boy comes to the OPD with the complaint of fever. For 3 days, enteric fever is suspected. What is the investigation of choice in this case? Answer is blood culture, viral test, stool culture, urine culture. A boy comes to the OPD with the complaint of fever for 3 days. Enteric fever is suspected. Which is the investigation of choice in this case? Is fever for 3 days. Fever for 3 days. In 3 days of incubation period, a boy comes to the OPD with the complaint of fever for 3 days. Enteric fever is suspected. What is the investigation of choice in this case? Answer is A. Blood culture. Explanation here. Enteric typhoid fever. Enteric typhoid fever is a systemic disease characterized by fever and abdominal pain and caused by dissemination of Salmonella typhi or Salmonella paratyphi. Diagnosis: because the clinical presentation of enteric fever is relatively non-specific, the diagnosis needs to be considered in any febrile traveler returning from a developing region, especially the Asiatic continent, the Philippines, or Latin America. Now shall have moved to another question. Which of the following change is not seen in a small bowel obstruction? Which of the following change is not seen in a small bowel obstruction? A dilatation of a small bowel, dilatation of large bowel, collapse of large bowel, and constipation. Which of the following change is not seen in a small bowel obstruction? Which of the following change is not seen in a small bowel obstruction? Dilatation of a small bowel, dilatation of large bowel, collapse of large bowel, constipation. The answer is B, dilatation of large bowel. Which of the following change is not seen in a small bowel obstruction? The answer is dilatation of large bowel. For the reference, we can see pie chart showing the common causes of dynamic intestinal obstruction and their relative frequencies. Adhesions 40%, obstructed or hernia 12%, miscellaneous 5%, pseudo obstruction 5%, fecal impaction 8%, fecal infection 8%, carcinoma 15%, inflammatory 15%, obstructed hernia 12%. Pathophysiology of intestinal obstruction. Irrespective of etiology, pathophysiology of obstruction, bowel obstruction, irrespective of etiology, acuteness of onset. In dynamic mechanical obstruction, the bowel proximal to the obstruction dilates and the bowel below the obstruction exhibits normal peristalsis and absorption until it becomes empty and collapses. Initially, proximal peristalsis is increased in an attempt to overcome the obstruction. If the obstruction is not relieved, the bowel continues to dilate and ultimately there is a reduction in peristaltic strength resulting in flaccidity and paralysis. Dynamic obstruction. The another question. Which parameter is same in pulmonary and systematic circulation? Which parameter is same in pulmonary and systematic circulation? Compliance, resistance, flow rate, mean pressure. Which parameter is same in pulmonary and systemic circulation? A. Compliance, B. Resistance, C. Flow rate, D. Mean pressure. The answer is flow rate. Which parameter is same in pulmonary and systemic circulation? The answer is flow rate. Nepal government has started weekly iron and folic acid tablet distribution program to reduce the incidence of anemia among adolescent girls. In this program, how many iron tablets are distributed to the girl in 1 year? Question is, Nepal government has started weekly iron and folic acid tablet distribution program to reduce the incidence of anemia among adolescent girls. In this program, how many iron tablets are distributed to the girl in 1 year? Answer is A 20, B 26, C 52, or D 42. The answer is B 26 tablets for one girl in 1 year. Explanation: iron folic acid is given to all adolescent girls aged 10 to 19 years 26 times in a year. Dose 60 mg ferrous sulfate, 400 mcg folic acid per dose. Shall we move to another question? राष्ट्रीय खोप तालिका. Lesion in amygdala is associated with A. Craving for mud, B. Inappropriate choice of food, C. Excessive fear, D. Less sexual drive. Lesion in amygdala is associated with, and the answer is B. Inappropriate choice of food. Inappropriate choice of food. Overall function of the amygdalas. The amygdala is seen to be behavioral awareness area that operate at a semi-consciousness level. They also seem to project into the limbic system one's current status in relation to both surroundings and thoughts. On the basis of this information, the amygdala is believed to make the person's behavioral response appropriate for each occasion. Effects of bilateral ablation of the amygdala. The Kluver-Bucy syndrome. The Kluver-Bucy syndrome. When the anterior parts of both temporal lobes are destroyed in a monkey, this procedure removes not only portions of temporal cortex but also of the amygdalas that lie inside these parts of the temporal lobes. This removal causes changes in behavioral called the Kluver-Bucy syndrome, which is demonstrated by an animal that is not afraid of anything, has extreme curiosity about everything, forgets rapidly, has a tendency to place everything in its mouth, and sometimes even tries to eat solid objects, and often has a drive so strong that it attempts to copulate with immature animals, animals of the wrong size, or even animals of different species. Now we move to another question. Bile salts act to contraction of gallbladder. B. Increasing absorption in duodenum. C. Increasing their own secretion. D. Increasing bilirubin secretion. The answer is C. Increasing their own secretion. Bile salts act to increasing their own secretion. An athlete got dehydrated and felt very thirsty during the football match. He drank a lot of water. Then, while playing, he suddenly got unconscious. Which mechanism explains the mechanism of unconsciousness of the athlete more accurately? A. Decreased intracellular tonicity. B. In decreased extracellular tonicity. C. Intracellular hypovolemia. D. Extracellular hypervolemia. The answer is B. Decreased extracellular tonicity. Decreased extracellular. It's a extracellular tonicity. Another question is a patient having enuresis. A patient having enuresis is diagnosed to have diabetes mellitus. What may be the character of urine passed by him? A. Hyperosmolar. B. Hypoosmolar. C. Isoosmolar. D. Normal. The answer is A. Hyperosmolar. Patient having enuresis is diagnosed to have diabetes mellitus. What may be the character of urine passed by him? The answer is hyperosmolar. An obese man develops severe airway obstruction during sleep. And on examination, he is cyanosed and his oxygen saturation is dropped. What will be the next immediate management? An obese man develops severe airway obstruction during sleep. On examination, he is cyanosed and his oxygen saturation is dropped. What will be the next immediate management? Oxygen inhalation, B. Ovulopalato-pharyngoplasty, C. CPAP, D. Tracheostomy. We shall go through the CPAP. The answer is CPAP. Continue positive airway pressure. Continue positive airway pressure. CPAP. Continue positive airway pressure. An obese man develops severe airway obstruction during sleep that is going to sleep apnea. On examination, he is cyanosed and his oxygen saturation dropped. What will be the next immediate management? Answers are A. Oxygen inhalation, B. Ovulopalato-pharyngoplasty, C. CPAP, D. Tracheostomy. The correct answer is CPAP. Conservative management improve modifiable risk factors. Weight loss, cessation of consumption of sedatives, alcohol, oral appliance of splints during sleep to prevent airway collapse, obstruction, positive airway pressure devices, spinal tract anatomy and function. Positive airway pressure device continues. Positive airway pressure, CPAP. CPAP, most effective treatment method. First step in management if patient is desaturated. Non-invasive ventilation that uses positive airway pressure to keep airway open improves restlessness, snoring, cognition, daytime somnolence, and quality of life. Low adherent rate. Bi-level positive airway pressure BiPAP provides a higher pressure during inhalation and a lower one during exhalation. Next is father of modern neurosurgery is Harvey Cushing, Joseph Priestley, C. Jules Cotard, D. Vladimir Bekhterev. The answer is Harvey Cushing. Father of modern neurosurgery is Harvey Cushing. Harvey Cushing. Father of modern neurosurgery is Harvey Cushing. Two scientists were given the same title of father of modern neurosurgery since only one of them is in the option. No any problem to choose. The answer is M. Gazi Yesargil, father of modern neurosurgery, and Harvey Cushing, the father of modern neurological surgery. Boundaries of next question is boundaries of Callot's triangle is formed by boundaries of Callot's triangle is formed by liver, Cyst- cystic duct, common hepatic duct. B. Liver, cystic duct, common bile duct. C. Cystic duct, common hepatic duct, common bile duct, and inferior vena cava, common hepatic duct, common bile duct. Calloused triangles. The border of calloused triangles are made by liver, cystic duct, and hepatic duct. Liver, cystic duct, and hepatic duct. Liver, cystic duct, and hepatic duct. Liver, cystic duct, hepatic duct. Liver, cystic duct, and hepatic duct. Boundaries of Callott's triangle. Hepatocystic triangle is a small potential triangle space at the porta hepatis of surgical importance as it is dissected during cholecystectomy. Now the next question is, a baby born from the mother having gestational diabetes mellitus. Gestational diabetes mellitus develops seizures few hours after birth. On beside te- uh, on beside test, blood glucose level is normal. What further investigation you suggest for the diagnosis? A baby born from the mother having gestational diabetes mellitus develops seizures few hours after birth. On beside test, blood glucose level is normal. What further investigation you suggest for the diagnosis? A. Serum potassium. A. Serum potassium. B. Serum calcium. C. Serum sodium. D. Intracranial ultrasound. The correct answer is B. Serum calcium. Why? The explanation are: neonatal complications include hypoglycemia less than 35 mg per dl is due to insulinemia. Hyperinsulinemia. Hypoglycemia less than 35 mg per dl is due to hyperinsulinemia. It is common in macrosomic infants. Respiratory distress syndrome is due to insulin that blocks the action of cortisol. Cortisol activates type 2 pneumocytes for the synthesis of phospholipids, surfactant phospholipids. Risk of RDS is reduced when diabetes is well controlled and delivery is done after 38 weeks of gestation. Hyperbilirubinemia is high, 25% to 50% due to increased red cell production, polycythemia, and breakdown of red cells. A baby born from the mother having gestational diabetes mellitus develops seizures a few hours after birth. On beside test, blood glucose level is normal. What further investigation is suggested for the diagnosis? The serum calcium. That's because the seizure. Serum sodium or serum potassium, intracranial ultrasound. The answer is serum calcium. Function of another question. An obese patient has type 2 diabetes mellitus and hypertension. He is under treatment with metformin. On lab examination, blood glucose level is 600 mg per dl. Blood urea and serum creatinine are raised, and HbA1c level is 7.7. What will be your next plan of treatment? An obese patient has type 2 diabetes mellitus and hypertension is under treatment with metformin. On lab examination, blood glucose level is 600 mg per dl, blood urea and serum creatinine are raised, and HbA1c level is 7.7. What will be your next plan of treatment? A. Switch the patient to insulin glargine. B. Prescribe empagliflozin and glimepiride. C. Canagliflozin and reduction of losartan dose. D. Continue metformin. The answer is switch the patient to insulin glargine. An obese patient has type 2 diabetes mellitus and hypertension. He is under treatment with metformin. On lab examination, blood glucose level is 600 mg per dl. Blood urea and serum creatinine are raised, and HbA1c level is 7.7. What will be your next plan of treatment? Answer are: A. Switch the patient to insulin glargine. B. Prescribe empagliflozin and glimepiride. C. Canagliflozin and reduction of losartan dose. D. Continue metformin. The correct answer is A. Switch the patient to insulin glargine. Explanation. Metformin is a potent blood glucose lowering treatment that is weight neutral or causes weight loss, does not cause hypoglycemia. Does not cause hypoglycemia. And has established benefits in microvascular disease. It is employed as first-line therapy in all patients who tolerate it, and its use is maintained when additional agents are added as glycemia deteriorate. Metformin is usually introduced at low dose 500 mg twice daily to minimize the risk of gastrointestinal side effects. The usual maintenance dose is 1 gram twice daily. There is a modified release formulation of metformin which may be later tolerated by patients with gastrointestinal side effects. Next question. Next question. A child with delayed developmental milestone is taken by his mother in the pediatric OPD for checkup. On examination, the child has a large head, wide fontanelles, and yellowish discoloration of skin and sclera and large abdomen. What may be the probable diagnosis? A. Thalassemia. B. Hypothyroidism. C. Down syndrome, Noonan syndrome. The answer is hypothyroidism. B. A child with delayed developmental milestone is taken by his mother in the pediatric OPD for checkup. On examination, the child has large head, wide bone tunnels, and yellowish discoloration of skin and sclera and large abdomen. What may be the probable diagnosis? A. Thalassemia. B. Hypothyroidism. C. Down syndrome. And D. Noonan syndrome. The answer is B. Hypothyroidism. Explanation. Clinical manifestations. Clinical manifestations. Clinical manifestations. Most infants with congenital hypothyroidism are asymptomatic at birth, even if there is complete agenesis of the thyroid gland. This situation is attributed to the transplacental passage of moderate amount of maternal T4. Next question. Which immunoglobulin is primarily found in colostrum? What is colostrum? Colostrum is a primitive milk. It is uh, discharged during it is discharged during pregnancy after delivery of baby. Which immunoglobulin is primarily found in colostrum? Answer are A. IgG, B. IgA, and C. IgM, and D. IgE. Which immunoglobulin is primarily found in colostrum? The answer is B. IgA. Immunoglobulin A is found in colostrum. Colostrum is the milk secreted during the initial 3 to 4 days after delivery. It is small in quantity, yellow and thick, and contains large amount of antibodies, chiefly as immunoglobulin A, and immunocompetent cells and vitamins A, D, E, and K. A, D, E, and K. Next question. A 61-year-old woman presents with overwhelming fatigue, headaches, and some blurry vision. She is worried that old age is finally catching up, while she is happy about losing 10 kg over the past month. On further questioning, she reveals that she is extremely itchy after a hot bath or shower. She is otherwise healthy. A blood smear shows red blood cells precursors. Which of the following is false about her condition? A. Erythroid progenitor cells are resistant to apoptosis. B. Autonomous clonal form of erythrocytosis. C. Elevated plasma erythropoietin level excludes polycythemia vera as the cause for erythrocytosis. D. Abundant bone marrow iron. And question is, a 61-year-old woman presents with overwhelming fatigue, headaches, and some blurry vision. She is worried that old age finally catching up. While she is happy about losing 10 kg over the past month, on further questioning, she reveals that she is extremely itchy after a hot bath or shower. She is otherwise healthy. A blood smear shows red blood cells precursors. Which of the following is false about her condition? Erythroid progenitor cells are present resistant to apoptosis. Autonomous clonal form of erythrocytosis. Elevated plasma erythropoietin level excludes polycythemia vera as the cause of erythrocytosis. Abundant bone marrow iron. D. The answer is D. Abundant bone marrow iron. Abundant bone marrow iron. Now explanation. Polycythemia vera. Polycythemia vera. The elevated platelet count may hinder marrow aspiration, but marrow biopsy usually reveals megakaryocyte hypertrophy and hyperplasia, as well as reticulum is increased. Another diagnosis should be considered the absence of sustainable iron demands an explanation because iron deficiency alone can cause thrombocytosis and absent marrow iron in the presence of marrow hypercellularity is a feature of PB. Next question is, which of the following is an ECG marker of abnormality in repolarization? In ECG, which of the following is an ECG marker of abnormality in repolarization? Pure interval dispersion, B. QT interval dispersion, C. J point dispersion, D. All of the above. PR interval dispersion, PR interval dispersion, B. QT interval dispersion, and C. J point dispersion, D. All of the above. The correct answer is QT interval dispersion. Which of the following is an ECG marker of abnormality in repolarization? The answer is QT interval dispersion. Two ECG markers of abnormalities in repolarization are QT interval dispersion and T-wave alternance. They identify patients who are at risk for sudden death from arrhythmias. QT interval dispersion refers to difference between maximal and minimal QT intervals from various leads on the standard ECG. T-wave alternance is defined as alternating T-wave amplitude from beat to beat on a special ECG recording techniques. Add another question. A 24-hour, not 24 hour, a 24-year-old patient has 4 days history of fever and cold. Crept are heard in bilateral lower chest regions. Neutrophil is the dominant cell type in alveolar space. Which of the following is the pathological phase of his pneumonia? A case of a 24-year-old patient has 4 days history of fever and cold. Crept are heard in bilateral lower chest regions. Neutrophil is the dominant cell type in alveolar space. Which of the following is the pathological phase of his pneumonia? A. Edema. B. Red hepatization. C. Gray hepatization. D. Resolution. The answer is gray hepatization C. Gray hepatization C. Classical pneumonia evolves through classic pneumonia evolves through a series of pathological changes. The initial phase is one of edema with the presence of a proteinaceous exudate and often of bacteria in the alveoli. This phase is rarely evident in clinical or autopsy specimens because of the rapid transition to the red hepatization phase. The presence of erythrocytes in the cellular intraalveolar exudate gives this second stage its name, but neutrophil influx is more important with regard to host defense. Bacteria are occasionally seen in pathologic specimens collected during this phase. Now, another question. Type 2 respiratory failure best relates to which of the following? Type 2 respiratory failures best relates to which of the following? A. Alveolar hyperventilation. B. Alveolar flooding. C. Hyperfusion of respiratory muscles. And D. Lung atelectasis. The correct answer is A. Alveolar hyperventilation. Alveolar hyperventilation. Type 2 respiratory failure best relates type 2 respiratory failures relates best relates to which of the following? Alveolar hypoventilation. This is a hypoventilation. Alveolar hypoventilation. The correct answer is A. Alveolar hypoventilation. Now explanation. Respiratory failure is one of the most reasons for ICU admission. Correct. In some ICUs, greater than or equal to 75% of patients require mechanical ventilation during their stay. Respiratory failure can be categorized mechanically on the basis of pathophysiologic derangements in respiratory function. Type 1 acute hypoxic respiratory failure. This type of respiratory failure occurs with alveolar flooding and the subsequent intrapulmonary shunt physiology. Alveolar flooding may be a consequence of pulmonary edema, pneumonia, or alveolar hemorrhage. Pulmonary edema can be further categorized as occurring due to elevated pulmonary microvascular pressure, as seen in heart failure and intravascular volume overload or ARDS, low pressure pulmonary edema. Acute onset less than equal to 1 week bilateral opacities on chest imaging that are not fully explained by cardiac failure or fluid overload and shunt physiology requiring positive in expiratory pressure. PEEP. Type 1 respiratory failure occurs in clinical settings such as sepsis, gastric aspiration pneumonia, near drowning, multiple blood transfusions, and pancreatitis. The mortality rate among patients with ARDS was traditionally very high, 50 to 70%, although changes in patient care have led to mortality rate closer to 30%. Type 2 respiratory failure. This type of respiratory failure is a consequence of alveolar hypoventilation and results from the inability to eliminate carbon dioxide effectively. Mechanisms are categorized by impaired central nervous system drive to breathe, impaired strength with failure of neuromuscular function in the respiratory system, and increased loads on the respiratory system. Reasons for diminished central nervous system drive to breathe include drug overdose, brainstem injury, sleep sleep very good. So reasons for diminished central nervous system drive to breathe includes drug overdose, brainstem injury, disordered breathing, and severe hypothyroidism. Reduced strength can be due to impaired neuromuscular transmission. Example, myasthenia gravis, Guillain-Barré syndrome, amyotrophic lateral sclerosis, or respiratory muscle weakness. Example, myopathy, electrolyte derangements, fatigue. Type 3 respiratory failure. Type 2 respiratory failure. This form of respiratory failure results from lung atelectasis. Because atelectasis occurs so commonly in the perioperative perioperative this form of respiratory failure results from a lung atelectasis because atelectasis occurs so commonly in the perioperative period. This form is also called perioperative respiratory failure. After general anesthesia, decrease in functional residual capacity lead to collapse of department lung units. Such electrolysis can be treated by frequent changes in position, chest physiotherapy, upright positioning, and control of incisional and abdominal pain. Non-invasive positive pressure ventilation may also be used to reverse regional atelectasis. Now, type 4 respiratory failure. This form results from hypoperfusion of respiratory muscles in patients in shock. Normally respiratory muscles consume less than 5% of total cardiac output and oxygen delivery. Patients in shock often experience respiratory distress due to pulmonary edema, example in cardiogenic shock, lactic acidosis, and anemia. The next question is exception to Courvoisier's law is double impaction. B. Portal lymphadenopathy. C. Periampullary carcinoma. D. Gallbladder ileus. The answer is A. Double impaction. Another question is most common paraneoplastic syndrome of hepatocellular carcinoma is answer A. Hypoglycemia, B. Hypertension, C. Hypocalcemia, D. Anemia. The correct answer is hypoglycemia, A. Most common paraneoplastic syndrome of hepatocellular carcinoma is answer is hypoglycemia.